Good day everyone. Today I am going to perform urinalysis. So urinalysis consists of 3 examinations: physical, chemical, and microscopic examination. So this is done to evaluate the patient's condition and to evaluate diseases such as urinary tract infection, kidney disease, and diabetes. So to start with, we have here our material, and now we are going to perform our physical examination. So first is to label our test tube with the patient's urine laboratory number. So we are going to label it with number 1. Then after labeling, we are going to mix the patient's urine sample. And after mixing, we are going to transfer the urine into the test tube. So for this test, we are going to assess the patient's or the color of the patient's urine by placing it under a white background. So we can see here that the color of the urine is clear. So for the clarity, we are going to place the tube with urine under a white printed background. So we can see here that the clarity of the patient's urine is clear, since we can still read the patient or the text behind it. So after the physical examination, we are going now to proceed to the chemical examination. So we are going to use a reagent strip consisting of 10 parameters. So we are going to dip the reagent strip in the urine sample quickly and completely. After that, we are going to blot it in a tissue paper to remove excess urine and to avoid cross-contamination. So after that, we are going to read the result following the testing time or the reading time of each parameter, and we are going to compare it in the expected result in the reagent bottle. So we are done with the chemical examination. So next is for the microscopic examination. So to do, we are going to prepare a clean glass slide and label it with the urine laboratory number. And after that, we are going to centrifugate our urine sample for 5 minutes at 2,500 gravity. So after centrifugation, we are going to decant the urine sample to get the precipitate. The decantation should be done with a flowing water. So after that, we are going to put the precipitate of the urine in a clean labeled glass slide, and spread by the use of the mouth of the test tube. Then after that, we are now going to turn on our microscope, and we are going to read the result or to examine the result under the low power field. And whenever we see any sediments or urinary cast, we are going to shift to high power field. Then finally, we are going to record our result. So for recording of result, patient's color is light yellow, then for clarity is clear. Then we are going also to record the chemical examination and the microscopic exam. So that ends the urinalysis. So now is to disinfect the area. So that ends our urinalysis. Thank you for watching.